Government fails, the world's off its rails, leaders are whacked, democracy is under attack. It's time to get smart, folks, time to get real. Let's cut through the crap, tell us how you feel. Let's cue the talent, let's meet the host. Podcast by George.
Hello, hi, how are you? Welcome back into another podcast by George. The self-quarantine continues, and we're going to talk about that a little bit. You know, I'm really quarantining. I've mentioned that all along. We don't go out much. We don't do anything. We're not going to gatherings. When we do go out, we wear masks, and it ain't very often. I mean, I'm pat myself on the back maybe, but I think I'm doing a pretty good job with this, unlike a lot of people, and we're going to talk about it today. Joining us on the Podcast by George live line is Dr. Megan Srinivas. She's an infectious disease doctor. She's educated at the University of Iowa and Harvard, and she's practicing in Fort Dodge. And I want to welcome the doc in. Dr. Srinivas, I almost had to laugh. If you ever have a Harvard reunion in Fort Dodge, and I know this because I live there, you might be a party of one. Welcome to the podcast.
Oh, thank you so much for having me.
We're delighted to have you here. The news continues to evolve, and I don't know. I'm getting a little more worried all the time, and I'm trying to think how we want to get into this. I want to maybe start by reading one of the more topical news items today that I thought was very interesting. And this is from the Des Moines Register, and it reads, a longtime spokesperson for the Iowa Department of Public Health said she was ousted Wednesday, said she believes it was partly because she was seen as too aggressive in sharing information with the media. Too aggressive in sharing information with the media. Now, folks that watch this podcast know there's going to be some major red flags and alarm bells going off when you hear that kind of thing, because I'm all about full disclosure. I mean, I don't like secrets. I was in the media. I mean, I'm a First Amendment advocate. I'm a trained journalist. You know, I'm not practicing anymore except for the podcast. But man, when people are, when they're put upon for being aggressive and releasing information in the media, I'm not up with that. And it's Polly Carver Kim. She said that she also may be why she was removed in March from the department's team that is responding to the coronavirus pandemic. I was embarrassed and saddened by the way the media has been treated during COVID, she says. You are not receiving timely answers, and you are getting scripted talking points when you do get an answer, she wrote in an email Wednesday to the Des Moines Register. Now, and I've even mentioned this on the podcast before. I try to watch those governors' news conferences. My God, it's hard to watch. I mean, and my wife, God love her, she's all over this. She watches everything. And I can hear her sometimes when I walk by the TV and watch it. She's watching this and she's saying, this is scripted. These are talking points. This is bullshit. I mean, that's what she's been saying ever since the governor started having those news conferences. And I'm watching it, and she's right. And here's Polly Carver Kim nicely saying mostly the same thing. Now, if you want to know what I'm talking about, listen to this. So this is from Amy McCoy. She also serves as a health department spokesperson. She defended the department's communications about the coronavirus. Now, just listen to her defense, and you'll see what I'm getting at here. She says, the Iowa Department of Public Health has gone above and beyond to provide up-to-date and comprehensive information throughout the pandemic. Okay, that was in an email Thursday morning. She says, quote, these efforts have included participating in regular press briefings. Okay, that's not the issue here. Constant communication with media. Yeah. And continuous improvement on how we report data and provide information. Well, okay, so what? We value the role media plays in the state's efforts to get information to the public and intend to continue a strong partnership. Folks, that's bullshit. I mean, that's obfuscation. That's smokescreen. That's talking around the issue. We've been telling you the truth. That's what I want to hear. Where is that in that comment? It's not there. You're not getting the real point. So that's my beginning. Now that's from me. And the viewpoints are mine, as everybody knows on this podcast. But I want to bring in Dr. Srinivas at this point and ask her, Doc, are we getting the straight story? Or when we look at these news reports coming out of those news conferences, are we getting the straight skinny?
I'm really concerned. I mean, the firing of Polly Carver Kim brings up many, many points that that show that we have a lack of transparency in the data that we're receiving. Not only is it her testimony, and she's been there for 13 years as a reliable spokesperson for the department, but the fact that she would say that, the fact that she has really facts to back that up. And then when we look at the press conferences themselves, it's really when we hear the journalists asking questions, that's when we hear the governor or the Sarah Rice Satter, who's a spokesperson that they have been using, that's when we hear them being pushed and often really avoiding answering those questions. Most of those questions go unanswered. And I have to commend the journalists who are out there because they continue to push. And without them pushing, we wouldn't realize that there's holes in the story that we're receiving. On top of that, the entire overhaul of the IDPH website, it took away a lot of the access to raw data. And in taking away that access to raw data, it really handcuffed many of us who are epidemiologists who are trying to use that information to analyze the true projections for what's happening in our state, and then using those to create policy recommendations as far as how we should be handling this on a public health standpoint. The fact that they would take away that data and instead present a lot of, well, I would almost call smoke screens, saying so many people recovered, when we know that the definition they're using for recovered isn't truly what I would consider on the medical side as somebody who's COVID recovered. Or so many people have so many people tested. It gives this false illusion that if you're tested, you're not susceptible to this virus, which isn't true at all. Just because you're tested once doesn't mean you can't go out and get infected later that same day or tomorrow or a week later. So a lot of these kind of smoke screens of statistics that lend people to have a false sense of security. It's all of these things that have greatly reduced the transparency. And if you look back to the papers that were written by the WHO, by the Imperial College, by all of these huge public health names, there was one major paper that was written after the SARS epidemic, came out around 2008. And in that, they really discussed what we needed to do the next time we had a coronavirus pandemic, because we expected it to be a respiratory coronavirus that really brought people to their knees in this type of a fashion, just with the way that physiologically a coronavirus works. And it specifically discusses in there that one of the main 3 points that we need to do in order to handle a pandemic successfully is communication and transparency with the public. That's something that we have not done at the national level, at the state level, at the local level, and it's very concerning to me. And then on top of that, in the midst of a pandemic, to say that we're going to combine two departments, that we're going to take away the leadership of the public health department because he's retiring, and instead of finding a new leader, putting it under the department head of DHS, who's already strained and is already a low-staffed department for what we need in our state, that's showing very, very short-sightedness in handling the public health response for this pandemic.
Well, like I tell folks all the time, when it comes to the pandemic, don't get your information from a podcaster and don't get it from a politician. As a matter of fact, a podcaster might be a better source. That's not where you want to get this information. You want to get it from a doctor, somebody that's been trained in infectious diseases, somebody that's Harvard educated, like Dr. Srinivas. I mean, this would be a good source of information. And when you're getting your information via words, every single word means something. If a politician is using those words, well, guess what? And you mentioned, Doc, at the beginning of your comments, that statistic about recoveries. Well, they cite the number of people that have recovered. A guy like me that had made his living with the word, I look at them and go, wait a minute. I'm not sure, but I think because this is a novel virus, they don't know if anybody is actually recovered, fully recovered when it comes to this virus. So to cite a recovery statistic like that is a little disingenuous. Would you agree with that?
Completely. And in fact, they changed the way they defined recovery just about a week or two ago in the state of Iowa. So before it was kind of based on checking in with people, or at least trying to, was what they said. And those people that stated they were recovered is who they counted. Now it's automatically based on if you're 28 days out from hospitalization or 28 days out from a positive test and are currently not hospitalized, they're counting you as recovered. But as we've seen, COVID doesn't go away that easily. The lung damage can last for months. It can cause heart damage. It can cause kidney damage. We can see ramifications for an entire lifetime. And like you said, it's so early in the course of this virus, we really don't know what the long-term consequences are in anybody, kids or adults. And that's really concerning. So to be able to cite a statistic that's based on not even the clinical evidence, that's counting a lot of people who would not count themselves as recovered, and say that to assuage the public is really disingenuous.
Well, and, just raising my eyebrows, just last night, now maybe you saw these news reports too, 1 in 3 kids that they're testing in Florida have COVID. 31% was the statistic. I couldn't believe that. And then talking about kids again, I've also saw something where they're seeing some incidents of some type of lung damage with these kids that have COVID that they may recuperate from, they may not.
Mm-hmm. Yeah. There's a lot of things we don't know about the virus still. So oftentimes when we're making suppositions early on and then trying to create public health decisions based on those assumptions, it's not the safest route to go. So you have to be very careful with knowing why a hypothesis is being made and what data is behind that hypothesis before we should be making public policy decisions based on that, because it's people's lives at risk. So for instance, with children, we really don't have the robust data to say that they're not infected at the same rate as adults. In fact, what's happening in Florida leads us to believe otherwise. And so making a decision that everybody go back to school in the exact same fashion, all schools reopen back to normal without precautions in place, based on the thought that they don't have the same infection rates as adults, is not a wise decision, because we don't know if that's true. In fact, we're starting to think it might be false.
Well, turning our attention back to the heartland, a lot of people mistakenly so think, oh, we're doing great. We don't have much of a problem here. And they've said that all along with the pandemic. And I looked at that and well, wait a minute. We're in the heartland. We're in the center of the country. We're a lower population state. Probably those things play a role. And now I find out that, and my wife told me this morning, Iowa is only one of 4 states in the entire country that does not have some type of a mandatory mask wearing law currently in effect. And I know you're all about the masks and you'd like to see government take a more active role in this.
Definitely. I mean, what we've seen, if you look at the data repeatedly over and over again, states where masks are mandated have had lower rates of transmission than states where they're not. And in fact, there are states like Rhode Island where movie theaters are open again. People are back to normal life as much as you can be. Sure, they're wearing a mask, but they can go out to eat with their friends safely and not worry about the infection transmission risk that we have here. I'm still terrified that anybody I know could get it. Anybody I know could pass away, because our infection trajectory is in an upward slope. And we're already in the red zone as far as states go in the United States. We're already in that we need to be very careful. We need to crack down. If you look at the CDC guidelines, what they've defined, even actually Webster County specifically as, is a red county in the country that needs to probably go back into complete lockdown. I don't foresee that happening. So right now, the biggest thing that we can do is really advocate for masks.
These statistics are alarming. They're very interesting. One thing that I'm seeing is that this is moving. It started with the older, more at-risk population, obviously. Now younger people are being infected and sickened. And there's a medical explanation for this, I assume, but some of that's also just common sense. I mean, as far as the way that it's migrating.
Mm-hmm. Yeah, I mean, exactly. It's anybody's really susceptible to this disease. Sure, we say older people are more predisposed to serious complications. But if you look at every age group and the complication ratio that happens, compare it to other diseases like heart disease, the likelihood that somebody who has COVID, who's 30 years old and has a complication, is much higher than that of having heart disease. So it's still, even though relatively a 30-year-old is safer than a 65-year-old from having a serious complication, they are still extremely high risk for having a complication because this is just a really bad disease. So with that, with people thinking that they're invincible because they're young, they're putting themselves more at harm's way. And so we're going to see that younger population having a higher infection rate just because they are the ones who are taking the risks right now. And then with that, we are going to have to see, unfortunately, some of those people having serious complications because that's just how this virus acts.
Let me cite a personal example here. There's a couple of interesting things about this. Number one, as more people have personal examples to cite, I think people will become more alarmed and aware of this. It used to be you didn't know anybody that had COVID. A lot of people know folks that had COVID now. We've got family friends, an older couple. This goes to the asymptomatic part of this and the invincibility part of it that you're talking about. They got invited to a family party. Well, it's hard for people to turn down family parties. They went to that. It was inside. They thought they were socially distancing at the 6-foot minimum distance or whatever. But when you get families together, I mean, that's hard to do. And no one was sick. Nobody had a fever. Younger people were there. This older couple was there. They come down with COVID. Bad. Somebody within the family asymptomatically transferred the COVID virus to them. And he about died. And so that's just an example of what can happen when families and people get together. You don't wear masks. Even if you do, if you're indoors, you're breathing the same air. What a horrible set of circumstances. But there's another interesting thing about this, Doc. Now, this is out in the rural area of the state, like where you're at. They go to the rural hospital. He has to be transferred. I mean, he's in a bad way to Des Moines for treatment. And he gets back home, and they gave him that Revastat, whatever that drug is that is commonly prescribed for this, has an extreme allergic reaction to it. I mean, that about took him out. Have you heard of that, people? And he had no known allergies other than a bee sting or something like that to prior to that, being allergic to any of these COVID drugs. And are those kind of statistics kept?
I mean, it's always possible. Remdesivir is an immunologic drug, so it really modulates your immune system. So it's definitely possible to have an allergic reaction to really anything. It's lower likelihood than other drugs that tend to have more allergies associated with them, like sulfa antibiotics, but it's definitely a possibility. And I'm so sorry to hear that that happened to your friend. Those statistics are usually kept by the CDC, but in all honesty, with everything we've been hearing about the CDC not unfortunately being in charge of data anymore or even having access to a lot of data, I'm not sure who's keeping the statistics nationally.
Yeah. Well, I didn't want to digress and get into a bunch of personal anecdotes, but this one is, I think, pretty prevalent out there. There are some people, I don't know if where they're getting their information, certainly, but they believe that these coronavirus, COVID statistics by the hospitals and medical practitioners, even by people like yourself, are artificially inflated for their own benefit, for their own hospitals, that they somehow benefit financially by over-reporting the incidence of COVID. Do you have any idea where that kind of a belief is coming from, what that's all about?
I mean, unfortunately, all these conspiracy theories can really pop out of nowhere. It can pop out of a politician who wants to disprove why we should be worried. It can pop out of really any source to try to discredit people and then spread like wildfire. But there's no truth to it. I mean, for instance, I as a physician, whenever I work in ICU or whenever I work inpatient and I unfortunately have a patient that passes away and I have to fill out that death certificate, if I lie on that death certificate, it's my license that's at risk. My pay doesn't change at all. I get the exact same salary from the hospital, whether somebody dies from liver disease or any other cause. So there's no incentive for me to actually change somebody's cause of death. And that, in a humanistic standpoint, why would you ever want to do that? This is somebody's life we're talking about. But if we really think there's a conspiracy financially, I wouldn't put my license at risk to change somebody's cause of death when there is no fiscal turnaround anyway. Not that I would ever be motivated by that.
Yeah, and that's just craziness that's out there. And to give you from the hospital's perspective, I told Katie Ousted that. Now, she's an ICU nurse down in Atlanta that I've had on the show before. And this is the way that she put it. She said, George, during the first wave of this in Atlanta, our hospital stopped all elective surgery procedures and converted everything into a COVID treatment area. That cost the hospital in Atlanta, I mean, I think it might be the biggest one down there, $600 million to do that. I mean, there obviously was no financial benefit in over-reporting or falsifying information about COVID. Well, that's just a crazy conspiracy theory. I don't want to end on that, certainly, and I don't want to spend a lot of time on it. And again, we're here in the heartland, but we're heard and seen all over the country, all around the world, Doc. Is there anything here in closing that you kind of want to reinforce or leave with folks? And it changes day to day, but where we're at right now.
Really, the biggest thing is if you want to save a life, you can do it by just wearing a mask or a face shield. It's simple, it's easy, it's the slightest inconvenience, but you really can save one, if not multiple lives by doing it when you're out in public.
That's great.
Oh, I was going to say, isn't a human life worth a slight inconvenience?
Yeah, to be a hero. And that's great because we feature heroes on the podcast all the time. That's a big item with me. So, I mean, you want to save a life? You want to be a hero? That's great. That's a great way of closing. And I wouldn't have thought of it like that. But it's something heroic that you can do with a minor inconvenience and save lives, particularly because of the transmission of this, the asymptomatic transmission of this. There was one other thing I wanted to ask you about here before we leave, and that has to do with the infectiousness of this. Is how long now do they, from the time that you're infected, I think I heard that you could display symptoms 2 weeks later. Has that window been shortened? I mean, if you're wondering whether or not you've been infected, you see the signs of this in 3 to 5 days or something like that?
You can see it in 3 to 5 days, but the range can go anywhere from 2 to 14 days is really typically what we're seeing. Okay. So it can be really pretty far after being infected that you see the symptoms and that you start to even think that you might have COVID. And on top of that, especially with it being summer and people having allergies flare up, you also have to take into account those first few days of symptoms. A lot of people don't even think of COVID as a possibility. The number of people who say, oh, I have a cough, I have a scratchy throat, but it's my allergies, I'm just taking allergy medicine, and don't even consider it. That's a huge risk because then they continue to go on acting normally and infecting other people if they in fact are infected with COVID.
And what's your advice if they do test positive?
If they do test positive, you have to go into strict isolation. Definitely talk to your personal physician because everybody's health is very different and the type of precautions you need to take is very different. But in general, go into strict isolation so you prevent any transmission to other people. And that isolation has to last at least 10 days after your positive test. And that's taking into account that your symptoms have completely gone away for at least 72 hours prior to ending isolation. In all honesty, we don't know how long people shed virus for. We've had cases where people are completely asymptomatic and continue to shed for 6 up to even 8 weeks. So there's so much we don't know about this. So even these day ranges are really kind of a guess on our part based on past viruses, based on what we're seeing so far. But there are aberrancies, and that can make people super spreaders, as we call them.
And if you've been infected, you can be reinfected. That's what they think right now.
That's what we think. So the early data is showing that the majority of people who are infected at day 60 after their test no longer have any antibodies present in their serum, their blood. And so without any antibodies, it leads us to assume that you can be reinfected, which would fit with other coronaviruses because the cold, you can get that more than once. But on top of that, we also don't know if antibodies are even protective. So even in that small group of people who might have antibodies, or earlier on at day 30 when some people might have antibodies still in their serum, what does that even mean? Does it actually confer any protection? We don't know.
Wow. Well, these are kind of in the quick hitter category. I kind of like to hit these little quick items at the end. One last one, I saw a piece where they said this fall, and this is what my big concern is. My God, we're supposed to be at the bottom of the trough. We're supposed to be in a lull right now. We're not supposed to be increasing in the incidence of this. That's very scary to me. But I saw this piece that said, based on what people like you are seeing now, there's no reason to believe that the virus this fall or winter will be more virulent, more deadly perhaps, but it may be more infectious. Is that so?
We're, in all honesty, not exactly sure what we're going to see. We're concerned that the transmission might be higher, not because of the virus itself necessarily changing, but for a few different reasons. It's going to be happening at the same time as other viruses that take hold, like the flu, cold viruses, anything else that can really make people sick. So when you hit them more than once with both COVID-19 and another virus that is hitting their immune system, hitting their organs at the same time, you're probably going to see worse consequences, and you're going to be concerned that people are going to be transmitting that. And then COVID lung. We've seen a lot of patients that will continue to have damage to their lungs. That's the perfect predisposition to getting sick again, whether it's from COVID again or whether it's from another virus like the flu. So with all of these things, we really are concerned that this upcoming fall/winter season is going to be worse, just in general, whether it's from the flu because it's going to have more of a predisposition to infecting people who already have COVID lung damage, or whether it's COVID really surging.
Well, listen to the good doctor, folks. Do the right thing. Be a hero. Save a life. As a matter of fact, if you want to log on to Podcast by George and leave me a message that you saved a life today, I'll cite you as a hero on the World Wide Web for wearing a mask, wearing a shield, doing all the right things. I mean, it's something that we all could and should do. Folks, joining us on the Podcast by George live line today is Dr. Megan Srinivas. She's an infectious disease doctor. She's educated at the University of Iowa and Harvard. I just love that. She's an outspoken advocate for healthcare in rural Iowa. She practices up in Fort Dodge, Iowa, and she's a new friend now of Podcast by George. And if you like this information, if you like the podcast, please, follow us on Twitter and subscribe to us on YouTube, like us on Facebook, and you can also get the audio-only portions everywhere those are heard, Spotify and iTunes and the iHeartRadio app and places like that. And we'll stay with it. We'll be on the case. We'll be following this with the good doctor, and we'll circle back with her again very soon, I hope. That's going to do it. That's all there is today. That's another podcast by George.